Yesterday, the Senate unveiled a health bill that could harm every member of a family. There we go. It's really impressive in its cruelty. Infants will be born to mothers blocked from accessing maternity care and unable to afford newborn care. Children will lose their health insurance, setting the stage for lifelong complications. Young adults will be sold worthless plans that will ensure that when an emergency strikes, so could bankruptcy. Middle-aged adults will face dramatic spikes in healthcare costs, and the elderly in nursing homes will lose care, left to somehow manage painful conditions on their own. All of this devastation will be to pay for massive tax breaks for the wealthy. The Senate is turning their backs on working-class families they represent in order to make their donors and their friends richer. And our senators are leading the charge. Despite Ted Cruz now whining that the bill doesn't harm people enough, both of them were on the drafting committee for the bill. Just 13 senators drafted this behind closed doors. And of course, until yesterday, the plans for this legislation were kept secret. Now, unfortunately, we know what they were plotting. There's a lot in the bill, and everyone's still unpacking it. But there are perhaps three key things that I wanted to describe today. One, and perhaps most important, is it dramatically cuts Medicaid. And I cannot stress the impact of this enough. Now, the CBO estimated Medicaid cuts in the House bill at $839 billion, which means cutting the program 25% by 2026. The Senate bill goes significantly farther. Their bill cuts federal Medicaid payments starting in 2020, then makes this cut even deeper after 5 years. In a state like Texas, where some of our officials are perfectly content to gut therapy services for children with disabilities, these cuts will be absolutely catastrophic. The Republican scheme will make young and old Texans sicker. The vast majority of those on Medicaid in Texas are children. This bill literally steals from them by slashing their health care. Medicaid also covers 67% in those in nursing homes across the country. This plan is a real death panel. Republican senators are all but ensuring many of those getting life-saving care through Medicaid today face misery and death tomorrow. The second point, it lowers the quality of insurance. States will be able to gut the ACA's requirement that plans cover essentials like emergency rooms and maternity care. One absurd argument that you might have seen is that by allowing these quote-unquote skimpy plans that don't cover too much to be sold again, healthy young people can save money by purchasing these plans. You know, until they get sick and need to pay for almost everything out of pocket. Insurance isn't for the expected, it is for the unexpected. By luring people into paying something for nothing, you're setting them up for long-term financial ruin. And defunding Planned Parenthood will keep millions from being able to access vital preventative care. Further, the plan allows for insurers to once more again discriminate against the 1 in 2 Americans that have a pre-existing condition. Finally, but no less importantly, it raises costs for almost everyone. With benefits removed from working people and given to corporations, families are going to see higher costs. Most people in the marketplace would be forced to purchase plans with deductibles around $7,350 a year, an increase of nearly $4,000 from what they're currently paying today. Insurers will be able to charge older people premiums that are 5 times those charged to younger, and if they receive financial assistance, require them to pay a greater percentage of their income in premiums.